Tomorrow, October 15th, 2023, is the start of open enrollment for Medicare. I know we've all heard about Medicare. It's from October 15th to December 7th of 2023. So if you have a patient that comes into the office and they have Medicare and another insurance, how do you know which one is primary and which one is secondary? We're going to be talking about all things coordination of benefits for Medicare. I spoke about coordination of benefits in general in my other video, so I'll link that above. But today is going to be all about Medicare. So keep watching. My name is Tamika. I'm a certified professional biller and a certified professional practice manager. So whether you are a medical biller or just a patient, you probably heard of Medicare. But we're going to do a little recap of who is eligible for Medicare. And then we're going to go further down and speak about different types of Medicare. And then we're going to get into the coordination of benefits for Medicare if you are a medical biller. So who's eligible to get Medicare? So you can get Medicare if you are 65 years of age or older, if you are disabled, if you have end-stage renal disease, or you have ALS. So in any of those instances, you are eligible for Medicare. And some people have to sign up for Medicare, and others will get it automatically if they have retired earlier than 65 or they get a disability check through Social Security. So we're going to go into a little bit about the original Medicare and Medicare Advantage. So originally we had the original Medicare, which was the red, white, and blue card, which is what I always tell my patients. Do you have the red, white, and blue card? They might not know if they have Medicare, but they always know if they have the red, white, and blue card. However, now we have Medicare Advantage. So there are a few differences with the Medicare Advantage and the original Medicare, and there are some similarities. So first of all, if you do not apply for Medicare Advantage, you will start out with Medicare, the original Medicare. So basically, when you apply for Medicare, you're applying for the original Medicare, not for Medicare Advantage, unless you say or you apply specifically for Medicare Advantage. Now, some of the benefits of the original Medicare are not, there are a lot of things that the original Medicare may not cover. And so if you get Medicare Advantage, they usually cover additional things like dental and vision and other things. Now, not all Medicare Advantage plans cover these additional things, but because the Medicare Advantage plans are through different insurances like, let's say, Humana or Cigna or United Healthcare, like there are different carriers who have Medicare Advantage plans, they offer different benefits. So just depending on what you need, what you want, and what you can afford, because along with that, you may or may not have an additional premium. So whether or not you get the original Medicare or Medicare Advantage, you will have a premium. And a premium being what you have to pay monthly to the specific insurer or the specific plan every month. So you have to pay a certain amount. Now, if you choose certain Medicare Advantage plans, you may have an additional premium to pay along with the regular premium. But you will have a premium when it comes to Medicare, whether it's the original or Medicare Advantage. Also, the original Medicare is Medicare Part A and Medicare Part B. Medicare Advantage is Medicare Part C. And then you hear about Medicare Part D, which is about drugs, but we're not going to get into that. So the original Medicare and the Medicare Advantage plans are the plans that you get to choose from or patients get to choose from when they are of age or they have any of those other specific things that I spoke about. Now, what is the importance of Medicare's COB when it comes to medical billing? It is very, very important. So you need to make sure that you know about this. Now, let me pull back a little bit, because most of the time, like I think I mentioned in the other video, the front desk is who would actually take that information, who does registration, who put that information in the system. So they're usually the ones who do that. So the medical biller is not the one who actually gets that information initially to begin with. But it is important to us, because when coordination of benefits is not correct in the system, then that gives us all types of problems in the long run. So it can affect timely filing, because if I sent the claim to the wrong insurance and then the right insurance that I was supposed to send it to has a timely filing of 30 days and that 30 days has passed, it can be a problem. It also can be a problem because I can lose or delay my revenue now, or the revenue of the provider, because revenue is most important. That's what we're trying to do. That's what we're trying to get for our providers. So the sooner we can get that money in, the sooner the better. But if we're here running around trying to find out which payer is supposed to be paying for the claim and all of those things, it delays our payments, and sometimes it's lost money because then we don't get to do it and we're losing out on money. Also, it's just a complete waste of time. If I can be totally honest, it's a complete waste of time. It takes up a lot of precious time that we can be doing something else instead of running around trying to figure out coordination of benefits. The other problem is that we, as the providers or in the provider office or working for the providers, we can't do the coordination of benefits setup for the patient. So we have to call the patient, have them call their insurance, keep calling them, following up, reminding them, because they need to know the importance of doing the coordination of benefits. Sometimes a lot of billers might say, well, I'll just send the statement to the patient and that's going to get them to get on the go and to get things fixed, which is true. Sometimes that do work. But again, we're not only in the business of making money for the provider, which is the main thing, but we also want to help our patients. I mean, I know I do. Comment below if you feel the same way as me. It's not just about getting money. For me, at least, I also want to help my patients, and if they don't have to pay, I want to be able to help them so that if they're paying for two insurances, that the insurance covers the claims that need to be covered. So let's jump into how COB works when it comes to Medicare and other insurances. So there are about 8 ways that I'm going to go over when it comes to Medicare and other insurances. So if you're 65 years of age or older and you have Medicare and you also have a group health plan, whether it's you, your spouse, or a family member that you're under, and they are currently working and the employer has 20 or more employees, then Medicare is secondary. But if you are 65 years or older and you have a group health plan, or your family member or whomever has the group health plan that you're under, and the employees are 20 or less, then Medicare is primary and the other insurance is secondary. So it depends on if you're currently working, number 1, if you're 65 years of age or older, number 2, and how much employees the employer has. So when you got a patient, they come in and they have this group plan, the front desk and yourself, you need to know that this is some of the questions that you need to ask to find out which would be considered primary and which would be considered secondary. Sometimes it's not set up right and you have to do a little bit more digging and fixing so that it can be set up correctly. Now the third one is if you have Medicare and you have a group health care plan, but under that plan, the person is retired that you're under, you are retired if it's yours, then Medicare is considered primary and the group plan is considered secondary. Then there's if you are under 65 and you're disabled, so you're eligible for Medicare or you have Medicare, but you also have a group health plan under your parent or your spouse or someone like that, and they are currently working, then Medicare will be considered secondary if the employer has 100 employees or more. Or Medicare will be considered primary if the employer has 100 employees or less. So to compare it to number 1 and 2, if there are two differences in this plan. If one was when the patient was 65 years of age or older, and the other one was when the patient is under 65 and disabled, and then you would decide whether or not the employer has a certain amount of employees. So if they are older than 65 and they are currently working, the employer has to have 20 or more, 20 or less. And if they are under 65 and disabled, the employer has to have over 100 or under 100. So that's the differences in those. So you have to know these numbers to know which one is primary and which one is secondary. Now, number 6 is if the patient has end-stage renal disease. And this is for whether the group health plan is for an employee who's current or a former employee. So if you have end-stage renal disease, Medicare would be considered secondary for the first 30 months. And then after the 30 months, Medicare will be considered primary. So that is something that's really important to know, because if you got a patient who just got Medicare and they have end-stage renal disease, you need to know that Medicare is secondary to their other insurance because it's within that first 30 months. So you need to know when Medicare started to know when the 30 months is going to be up, so that Medicare would then change over to being primary. Number 7 is if the patient has TRICARE. So if the patient is not on active duty and they have TRICARE, then Medicare is primary and TRICARE is secondary. But if the patient is in active duty or they're getting services from a military hospital, then Medicare would be secondary and TRICARE would be primary. And last but not least, which is the easiest one, because we all know, if you've been in billing for any time, that if a patient has Medicaid, we call it MAP in the Virgin Islands, medical assistance, whatever you may call it in your area, then Medicare will be primary and the Medicaid would be secondary. Because as we all know, in the other video that I said, Medicaid is secondary to everything. Anything else that you have along with Medicaid, that other thing is primary and Medicaid is secondary. So we've gone through all 8 of the possible scenarios that could be out there for someone who has Medicare and another insurance. So if you have any more, which I don't think there's any more, but if you do have any more, leave them in the comments below. If you have any questions, leave them in the comments below. And I will see you again in the next video.